Hello and welcome to the Minds on the Frontline podcast. I'm Jeff Lassers, one of your hosts, and I'm a professional firefighter, paramedic, educator, and content creator. My co-host today is Mike Matter, also a firefighter, paramedic, and he's a peer support team expert. Our goal on this podcast has always been to reflect the whole reality of frontline work and the people that do it. That means recognizing the different experiences, different stressors, and different risks across our professions. For many first responders, especially firefighters, the long-term health risks associated with their job are significant and often overlooked. Shift work, disrupted sleep, chronic stress, environmental exposures, and a culture that encourages pushing through can gradually take a huge toll. However, routine health screenings and prevention are often delayed, sometimes until minor issues turn into big problems. And that is why this conversation matters. Today we welcome Dr. Michael Lutz, a retired urologist and the president and CEO of the Michigan Men's Health Foundation. Over his 40-year medical career in Metro Detroit, he has advanced prostate cancer screening, early detection, and men's preventative health. Through the Michigan Men's Health Foundation, he has facilitated free, community-based health screenings for tens of thousands of men all across Michigan. And these efforts have helped overcome barriers like cost, access, and stigma while ensuring men receive follow-up care when health issues are detected. Dr. Lutz understands the unique risks faced by first responders, and he offers practical, evidence-based insights into how prevention and early action can improve men's health outcomes in frontline work. During this episode, we discuss why regular screenings and knowing your baseline health data are critical, how shift work has a huge negative impact on health, and we talk about why prevention is essential for maintaining physical and mental health. The Michigan Men's Health Foundation frequently collaborates with first responder agencies to provide on-site screening and remove barriers to care. If your agency would like to learn more, you can visit michiganmenshealthfoundation.org, or you can contact them by email at info@michiganmenshealthfoundation.org. Minds on the Frontline is presented by the Frontline Strong Together 5 program. FST5 offers 24/7 mental health and crisis support for Michigan's first responders and their families. If you or someone else you know needs help, call 1-833-34-STRONG or visit fst5.org to learn more and explore our free training options for Michigan's frontline agencies. Wayne State University administers FST5 with grant funding from the Michigan Department of Health and Human Services. Together, we're dedicated to strengthening the health, resilience, and well-being of Michigan's frontline community. Please follow us on social media and enjoy the show. Good morning, sir.
It's great to be here.
Thanks for coming in this morning. Dr. Lutz, please introduce yourself, who you are, what you do, your career. I know you're retired now with grandbabies.
Sure.
But other than that, what did you do before that?
I'm a urologist and have been for over 40 years. Graduated from Henry Ford Hospital's residency program back in 1986 and practiced in the greater Detroit community for my entire career. You know, I was in the beginning of prostate cancer screening. And what I mean by that is that imagine that PSA blood test that everybody talks about, prostatic specific antigen, has only been around since 1979. That's when it was discovered. And when that test was discovered, it changed the entire face of diagnosing prostate cancer. It was the most revolutionary blood test tool ever, and still is an important blood test. And the reason is because before that blood test, over 50% of men, when they were diagnosed with prostate cancer, it was metastatic in the bones, and they were going to die from their disease.
Wow.
Couldn't find it. Couldn't find the disease. It was almost impossible.
Remind everybody listening what the difference is now and the expectation when you get a diagnosis of prostate cancer.
So the difference now is that over 90% of men, when they're diagnosed with prostate cancer now, can actually watch the disease and will die with it, not from it.
Wow. So the screening tools have become these life-saving opportunities.
Totally. And the problem is that our federal government, the U.S. Preventive Services Task Force, have muddied up the whole concept so badly since 2012, since they've come out with their recommendations, giving it a D, don't do it rating. And now they've come out with a more modified, like only with, conversation with your doctor and don't screen past age 69. which makes even less sense because it's a disease of aging. We have a real problem on our hands.
So you're saying that the problem is specifically the screening test is not just used as often as it should be based on its efficacy?
Correct. It's not being done pervasively. And if you look at communities around the globe that have really used screening properly, they're showing that screening saves lives, and a lot of lives. And, people don't understand is that if you treat a guy with early prostate cancer, it's a lot cheaper and a lot better for the patient than waiting till it's metastatic or out of the box, because it's very costly and they will likely die from their disease. So I think the decision's pretty easy. I don't think it's that hard to make a decision that screening can save lives. Therefore, we should screen more men and we should screen better. And our goal in our foundation is to try and democratize the screening process, is to make it available for everybody and to avoid financial and personal toxicity that men can endure if it's not done properly. And so our mission in our foundation is to go into the communities and to offer a democratized method of screening for prostate cancer for all men.
The foundation we're talking about is actually the Michigan Men's Health Foundation. Can you explain a little bit what the foundation does and kind of the mission and why it's so vital to not only first responders, their families, but just the community in general?
So I practiced as a urologist since 1986, and my form thrust was to be a prostate cancer doctor, whether it be screening, diagnosis, management. And then along the way, it was like we should do some support groups, because you're not just treating the patient, you're treating their families. So we developed the first US2 prostate cancer support group in the state of Michigan in 1989. And then we joined with Prostate Cancer Awareness Week, and it was like, okay, once you start doing these things for community, you get hooked. You want to do more. And you know that as a first responder, that's kind of who you are. That's your DNA. And so we merged with the Michigan Institute of Urology, our group of 3, and became a group of 21, and then soon became a group of 55. And when we joined this group in 2008, the thought was, what can we do more to help the community? So we formed this foundation, the Michigan Men's Health Foundation. And we first started as a prostate cancer run for patients and their families at the Detroit Zoo on Father's Day, being symbolic for men's health. And then we expanded because the thought was, well, prostate cancer survivorship is more than just that. It's actually men's health. And men's health is more than just prostate cancer. So let's create a men's health foundation and let's do a men's health event and see how many men really care about their health. Well, we took over the banquet area over at the Troy Marriott, and a lot of people would say, well, nobody's going to show for this. Guys don't care about their health. Well, they were totally wrong, because we had 400 guys show up at the front door at 9 a.m. to get screened that day. And we had over 600 guys get screened in one day over at the Troy Marriott. And we said, well, we've outgrown this venue in our first year. Where can we go now? So we went to Ford Field. And we've held an event at Ford Field every year since 2011. And there was only 1 year that we didn't do it, and that was in 2020. And we're incredibly proud of the fact that in 2020, in the height of COVID, our foundation actually held the only men's health event in the entire United States at the Michigan State Fairgrounds. As a drive-through event. We screened 650 men in full PPF. They were everybody was covered in all their clothing and masks, and because we didn't have a vaccine then, so everybody,
I like your attitude.
Everybody's scared to death. Yeah. Don't give me that COVID.
Yeah. 7-foot Q-tip.
Yeah.
Yeah.
Q-tip on a stick.
Yes. Yeah, don't come near me.
Yeah.
And we screened these guys. We did their vitals. We gave them all their flu shots and other vaccines that year. And we gave them food securities in the trunks of their cars as they drove off. And we were very proud of this event. And so we know as a Men's Health Foundation, we can do whatever we set out to do. And we believe in doing that with a lot of partners. And so our foundations continue to grow, and we're excited to do stuff. So let's keep talking about it.
Yeah, man.
Absolutely.
Where does that passion come from? You were so passionate that you found out that this thing actually saves lives that you were like, I got to keep on my foot on the gas.
Well, yeah, but it didn't start that way, because being a typical doctor, you don't really care that way about community, You
don't think that way early, sure.
Physicians typically aren't wired like that. Physicians will wake up each day and think, oh my God, I got to see these 47 patients. I got to do these 20 surgeries, and then I'm going to be on call for the next week, and I can't wait to get home and get some sleep. And so that really wasn't in my DNA, but it was in my wife's DNA. And she probably started it with one of my favorite stories, which is one day, my wife and I were just starting to get together in our lives. And she said, we should give money to the homeless. And I thought, it's a good idea. But I said, here, do me a favor, get me an address. I thought that was funny.
Mm-hmm. That is kind of funny. Yeah. Where do I send it?
Next day, she had an address on my desk. And so she's the one who got me started. She's the one who really believes that the community is bigger than one of us. It's really all of us working together to really make it better for all of us. And so, again, it just started with helping patients and their families. And then before you know it, you're seeing how much can we do? We can do more.
You're kind of selfishly enjoying the feeling of giving.
Oh, my God. And then the amount of people that come up to you and tell you that, you discovered my prostate cancer at this event last year, or they found my thyroid cancer when they did my oral cancer screenings. Thank you so much. And honestly, our men's health event, what really makes it most amazing, and I tell everybody, if you volunteer at this event, you will walk away with the best feeling of your entire life, because all people say is thank you all day long.
That's really wonderful to hear.
So that event, is it one time downtown, or do you have more across the state throughout the?
Funny you should ask. At present, we only have the one, and we're actually moving it from Ford Field to the Wayne State University Field House this year. The day is September 26th, 2026.
Perfect.
All right.
We're very excited, and we love the partnership. We love the relationship. The Detroit Pistons are going to be a partner with us. Henry Ford Health wants to step up and partner with us. And we have a great partnership with Corewell Health. So, it's great having the pharmaceutical industry and the healthcare industry, and everybody is getting behind this because they know that this event really does its job. My favorite statistic is that about 1 out of every 3 men who come to our men's health event are found to have some health problem. Something.
Mm-hmm.
91% of those men go on and get the follow-up care that they need. So this event not only screens and discovers health issues, but they get addressed and they get the follow-up care that they need. So this does get guys engaged in their health care and makes it more proactive. And if you look at the data from the men who sequentially attend this one-day event, they're getting healthier perceptively and in their reality of health. So it's really important that they do this. And so we decided that a one-day men's health event is great, but what could be better? Do it year-round.
Yeah.
So that's why we're developing a mobile men's health clinic that's going to work in partnership with organizations around the state of Michigan. And we're going to go to underserved communities and, as I said before, try and democratize the screening process so that every man, whoever they are, wherever they live, whatever their health and financial status is, they can get the same health care in any community, anywhere in the state of Michigan, as if they were to go to a big medical center.
That's
same
awesome.
Baseline data that every human being should be tracking, specifically men for their hormone balances and everything else.
Right. Get screened and get knowledge, because I always say knowledge is power, and, just not knowing is not an adequate answer.
I like that. Okay, let's get into some of that part of your brain that's more the doctor and not the really inspired entrepreneur.
I studied last night, so I'm ready.
I love it. I want to get into more of your medical school knowledge and all of your years in practice. So, many men in the frontline roles, we tie our identity to pride, toughness, masculinity, resilience. So how does this mindset influence how many first responders might see health, vulnerability, and asking for help or even screening?
Well, you so answered that question, because the reality is that guys in general, because of some degree of masculinity and some of the toxic side effects of masculinity, inhibit them from wanting to get screened. It's showing any signs of being vulnerable or weakness, because weakness is not strength, which in reality it's the converse. Strength is showing your weakness. Strength is identifying that you can have a weakness, and it's okay, because your weakness can be converted once you identify it. If you don't identify it, it's always going to be a weakness. So the key is to really be in touch with who you are and accepting that you're not always going to be strong, that it's okay to have moments of weakness and let people help you. Seeking help is not a sign of weakness, and that's what we do, is to say, hey, we're here. And say, okay, even if you don't think you have a weakness, let's just go ahead and do an assessment. Let's just see where you're at. So knowledge, as I said, is power. And so getting knowledge about who you are and what makes you tick is really important. So we try to get guys engaged and to get screened. Just get screened. Just let us do the test. Let us take care of you. So for one moment in your life, just sit back, relax, and let us do the work.
But I got a quick question on that one, follow-up. Is it generational, do you think? No, you started in the 80s.
It's how guys are raised.
It's just the same thing?
Yeah.
Now, you remarked earlier that you were surprised how many people came for a screening.
Yeah.
And I wonder if you did the same foundation in 1991, if it would have been any more.
Oh, it's different. Oh, there's no question about that. That we have definitely matured as a male society.
Accepted some data.
Oh, without a doubt. You could go to our men's health event and see guys openly standing in line for HIV screening. I mean, that's incredible.
Yeah.
And 10 or 20 years ago, not as much. People were definitely not as open to get screened or to be screened for HIV especially. So I think that we've become a more open society. We're more tolerant. We're more acceptant of things like this in some areas. In some areas, we're obviously not. Sure. I mean, we wanted to do a campaign. We started this campaign called Got Nuts, Check 'em for testicular cancer awareness.
How do I get that T-shirt, man?
It was a great logo.
Yeah.
Love the logo.
Yeah.
We even put it on beer trucks. Thanks to our buddies.
Awesome.
It powers beer distributing. They put it all over their beer trucks throughout the month of June.
Yeah.
And you know what they never realized is how many people read their damn beer trucks. And they got so many hate phone calls.
Really?
Oh, yeah.
Come on.
Yeah, people said, "Oh, I don't want my kids to see this. What should I tell my son?"
Tell him about cancer.
Exactly.
Yeah,
Tell him you should touch him once in a while and check him.
Exactly. So testicular self-examination, again, thank you, U.S. Preventive Services Task Force. They said they gave that a D rating too. Don't do it.
Really?
Yeah, they don't want guys to be in touch with their bodies, physically or emotionally. Yeah. They think, well,
Is it the new age perception of toxic masculinity is like the evil right now?
I think it's that part's going the wrong way. And so we have a whole group of researchers across the United States who have partnered together to try and change the D rating to get guys engaged, to get guys to examine themselves, be in touch with their bodies, understand that testicular self-examination is important, and it's one of the first steps for a young male to be in touch with their bodies, and don't give that up. Be aware of your wellness and start as a young male. Don't wait until it's too late.
And don't be shamed at it.
Yeah. So testicular self-examination is a big thing. And so we started this campaign, Got Nuts, Check 'em. And so we created these bags of nuts in partnership with Carr's Peanut Company here in Detroit. What a fantastic, got the perfect pair. Seriously.
I know, man.
So we had these bags of nuts and they distributed them to all of their stores, Hollywood Market, Plum Market, and Papa Joe's, Kroger, and they went on all the shelves. And what did we learn? That within 2 days, all the stores took them off their shelves. They thought they thought, no, we can't do this.
Karen went to the counter, huh?
It wasn't right.
Oh my gosh, man.
And so I went to a friend of mine who's a breast cancer advocate, and I said, okay, explain to me how Save the Tatas and all of these campaigns are good, yet Got Nuts, Check 'em is bad. They said, it's not ready for prime time. It's just
the time.
I'm going to tell you right now. Start in the first responder community.
Say, you're going the wrong place, man.
And you will absolutely excel and take off.
Yeah, I can think of 12 conferences that you won't be able to keep stock.
Yes, I'm telling you right now because the what you're doing is right in our wheelhouse.
Oh man, we got to talk after this.
Yeah, we got to. Yeah, we'll get you the right.
So we'll get the folks at Cars back on board.
Yeah,
they will sell a ton.
You won't be able to keep them in stock.
No,
that's what needs to be done.
Especially so like this time of year where you could buy presents and stuff.
Oh yeah.
Oh my God. Anyway,
so Doc, let's kind of get in the nuts and bolts of this now.
Oh really?
Yeah. Oh yeah. See, I threw that one in. Yeah. So we're kind of talking, and obviously the shift work that we do, the sleepless nights that we have, the stressors that we encounter in the first responder community, we know it wreaks havoc on our bodies. How does this affect not only our physical health, but also our hormone levels and mental well-being over time?
Well, bottom line is you're screwed. About 17% of men do shift duties, and they hold the bulk of metabolic diseases and mental health disorders because of the loss of the proper circadian rhythms. Because your circadian rhythm is everything. You have people whine all the time about flipping your clocks for daylight savings time and moving an hour forward, moving an hour back. It kills me. I can't live. I can't survive. Well, that's just 1 hour twice a year. Imagine if you spend your entire career out of sync, where your clock is off by 8 hours or 12 hours, and you are not in sync ever. And so your body just doesn't know which way is which. And so it messes everything up. So the degree of metabolic disorders and secondary malignancies and mental health disorders that people like firefighters struggle with is real. And that's just the biological clock being messed up. That doesn't even address all the other risk factors, particularly firefighters who, are hanging around all those volatile organic compounds in the communities. People think, well, they went in that fire and the fire was out, so no big deal. Well, think about 9/11 just for 1 minute of what happened to all of those firefighters in the city of New York. For months, there was heat coming off of those Twin Towers. And that was just the heat, let alone the volatile organic compounds of all the toxic chemicals that were being burned. I think people in the state of Michigan are starting to understand that a little bit better because of the Canadian wildfires and that toxic smoke that's coming into the state of Michigan. And the air quality is so poor for so long that's not even here. That's from miles away, and we're getting the toxic side effects. And so getting this back into the conversation that we're talking about today, specifically firefighters, we understand that it's effects of the biologic clock, from changes in circadian rhythm to physical and mental abnormalities that occur secondary to those, and then the toxicities of volatile organic compounds. All these things take a toll on firefighters and need to be understood and addressed. And that's why certain screenings must take place for firefighters, more so than the average Joe in the community. Let's just take prostate cancer, for instance. Firefighters have at least a 20% higher risk of getting prostate cancer than the general community, which is already a 1 in 8 risk and a lifetime risk. So firefighters are now in that same group of men who are men of African descent who have a higher risk of prostate cancer. Fighter pilots, I don't know if a lot of people know this, but fighter pilots have a significantly higher risk for prostate cancer than the general population. And we believe it's from their exposure to microwave energies, from all the radar equipment that sits in the cockpit that their legs straddle as they fly these fighter jets. They also have a significantly higher risk of melanoma, because think they're flying in these high altitudes where they don't get the protection from the atmosphere, and they're getting exposed. So it's really important to know that if you're a person at risk, you need to get the proper screenings. And that's really the goal. Someone says, what is the goal of your foundation? Our goal is to get out there and get the message in the communities that there are people who are at risk for certain diseases. We need to not only screen those men and offer the care that they need, but the communities who benefit from their services, the communities that benefit from having a firefighter that runs towards the danger when we run away from it, the benefits that we get from those men in the armed services, we need to help protect them. And we need to not only share their message of what they need and what they should benefit from us, but we need to share the message to the people like firefighters and those men who are fighter pilots and African-American men in the communities who are at increased risk for these diseases, to get those care and services that they perhaps might not actually get.
So you talked about they should get certain screenings, right? What are some of the screenings that you're talking about that would be important for them to look at? And what should they be asking their doctor to be screened for?
Any good physician will get the basic blood test. We'll get a CBC, or complete blood count, to make sure that they're not anemic. We'll get an electrolyte panel to make sure that their electrolytes are fine and their kidney function is okay. To get a hemoglobin A1C to make sure that they're not pre-diabetic, because of the incidence of diabetes and metabolic disorders is so high, particularly in individuals who do shift duties, such as firefighters. But they should also get basic things like a PSA blood test for prostate cancer screening, and they should start at age 40, and it should be low. It should be below 2 for certain. And if it's above 2, then they should start having a conversation with a urologist about maybe getting what we call a liquid biopsy test, which are these blood tests that have very good sensitivity at predicting whether or not you're at increased risk for prostate cancer or at low risk for prostate cancer by doing a test such as that nature. And then testosterone, getting baseline testosterone levels as a young male, making sure that you are functioning on all cylinders. Lipid tests to make sure that your lipids are fine and intact, because again, with metabolic disorders, you might have high cholesterol or high LDL levels. And more recently, there's a blood test called lipoprotein A, which we offered at our most recent Men's Health event, which is a very, very old test, but a very new test because it went out of favor. It was discovered in Norway over 40 years ago and went into disfavor because they had no way to treat it. But there's now medications that can actually specifically treat it. And it looks like that 50% of heart disease is related to lipoprotein A and elevated levels. And it is genetic. And it's a once-in-a-lifetime test. Once you get one done, that is your fingerprint for your entire life.
Oh, wow.
So you don't need to keep getting it drawn and drawn and drawn. Just get it drawn once and know what your LPA or lipoprotein A levels are. And if you're low or low risk, that's great. But if you're elevated, then you really should get it addressed because you could be at increased risk for heart disease. And particularly if you're a man with high risk of heart disease in your family, you should get that done. So these are really key tests because the number one cause of death for men is cardiac disease. The number two cause is malignancies or cancer, particularly prostate cancer. It's high up. But for firefighters in particular, it is prostate cancer, it's testicular cancer, it's skin cancer. And you see that malignancies are pretty high amongst firefighters. And so we really tell firefighters to really get those screenings and start early and be consistent. Get them done on a regular basis because you really have to watch your health more so than the average person in the community.
That's awesome. Thank you for all those. And, one of them that I really want to hit on, and it seems like it's just been recently that it's really gotten prevalent in the first responder community, is the testosterone. Everybody thinks they have low testosterone.
Well, everybody wants a low testosterone reading so that the doctor will prescribe testosterone.
So
it's kind of a thing right now.
Well, the interesting thing is that the symptoms of low T are crossover with almost everything.
Especially shift work.
Especially
tired, cranky.
Yeah.
If your T is normal, and I don't mean just total T, but I mean your free testosterone. Sure. And the key thing about testosterone is that it peaks at about 5 a.m. And that's if you have normal shift duties. It's kind of a challenge to figure out when the proper time to draw it is on somebody that's working shift duties, but it still should be around 5 a.m. as your peak level. After about age 44, the diurnal variation actually dissipates. And what I mean by that is that your peak level at 5 a.m. is not necessarily the only time that it's high. After about age 44, the curve kind of flattens out a bit, so you can almost draw it at any time of the day after about age 44. But the key thing is not only to know your total T, but to know your free T. One of the issues that a lot of guys don't know is that replacing testosterone or boosting your testosterone levels, if you are planning on having kids, you better be careful because if you want to maintain your fertility is a problem. It actually shuts your testicles down and shuts your sperm counts to very low. I wouldn't say to use that as a method of birth control.
I was going to say, a couple guys, that'd be a reason to take it.
I'm glad we said that. Because,
that would be a bad idea because it doesn't work well enough to stop one from getting past the goalie. Sure. So I would definitely be very careful about that. But if you take it for a long period of time, you can suppress your testes enough that your fertility could be compromised forever. And that's a bad thing. And there are ways to boost your testosterone for guys to actually still maintain your sperm count. Interestingly, this is a great story. It just happened recently in the news, is that there was an NFL football player who was getting his routine drug testing. And they found his HCG levels were really sky high. And they thought, okay, dude, what are you doing? You taking something to get your testosterone levels up? And he goes, I'm not, because I'm not taking anything. He says, well, then you got a bigger problem. It turned out he had a testicular cancer.
Wow. Oh, it was an overproduction of it.
And it was making the HCG. And they discovered his testicular cancer. He went and he played his football game in the NFL. And the next day he went ahead and had his testicle removed for his malignancy. And he's just now back at playing.
Wow. No way.
So it's a great story. It shows that actually even screening in the NFL can actually have positive benefits. But, testosterone replacement therapy has been around for a long time.
Right.
And we're just getting better at it. We used to think that testosterone replacement therapy caused prostate cancer. There's no evidence to that effect anymore. The data is out that it does not cause prostate cancer, and you just need to be watched, just like you would anybody.
What is the data or the threshold or whatever the line is that you would recommend somebody considering testosterone replacement therapy?
If your free testosterone is low, you should consider it.
What is low to you?
It's all relative.
Right. That's what I wanted to
It depends on the lab.
Yes.
So every lab has different values. And so you kind of have to check with different labs and which one you're getting it drawn at. And so that's really the key.
And on top of that, and I'm sure you've got guys at your place that are on it.
They are.
How high do you want it to get? Because, you're talking to guys who are like, hey, mine's at like 1,100. And you're like, wow.
We got guys with higher than that.
Yeah. So, I mean, what is the safe ceiling of,
or is there one?
Nobody knows.
Okay. Fair answer.
Nobody really knows.
There's no epidemic of people dying from too much testosterone right now?
No. You can have complications from the side effects, but you can still get that even at low levels.
Sure.
So it's not necessarily the level of replacement that's going to determine the complications. But the biggest complication is bone marrow toxicity and increasing your red blood cell count to high levels and your hematocrit too high. The analogy I always tell patients is that it's like putting too thick of an oil in your engine, and your engine just can't work anymore. And that's what happens to your heart. If your red blood cell indices get too high, your heart as a pump will fail, and you can actually then end up with a heart attack or a stroke.
Is there a way to monitor that?
All the time.
Yeah, I was going to say, there's got to be a way to monitor that if you're going to have that therapy.
Right. Now, so I've had patients during the course of therapy who are happy at certain levels. Sometimes I'll try them on alternative therapies that don't cause the bone marrow toxicities. Some of the testosterone replacements now can actually not cause bone marrow toxicity, so you can actually switch to different agents or replacement options. And the other option is just to monitor it. And if your blood count indices get too high, you can also get your blood donated through the Red Cross. They will accept you. Most of the facilities, some of them might kick you out if they know you're on testosterone, say, no, we can't use your blood. But that's baloney because most of them will. And that's one way. And the other is just to go ahead and have blood removed at a hematologist's office, which I've had patients do during their course of therapy. You can try reducing their testosterone replacement amounts, but most guys are not happy with that, and that actually creates a negative outcome. And so everybody loses. The patient loses, you lose because they're not happy, and you're not really creating what you wanted for them in the end. So you have to look for happy solutions, and there really are. There's really options.
Is it safe to say it's different for everybody based on their gene profile, their current health status, who they are, what they are, all those things?
Everybody responds differently.
Right. So there's no number here.
There isn't. And so, everybody has a standard initiation for therapy, but then
That's where I'm at. They're like, it's 200, it's 300. It's like, well, how do you feel?
Right.
Yeah. I guess on the flip side of that is you've got the guys who are taking the replacement therapy, but then you have the guys who are spending a ton of money on natural testosterone boosters, right? In your opinion, following the data, is there any of those natural kind of testosterone boosters that actually work to boost that testosterone, or is there any way naturally to do it?
I have never seen any product available in the open market that will boost your testosterone.
There you go.
Not once.
You heard it here.
You heard it here.
And, there are so many ways that you can effectively do it. And that's why, you should find somebody that's really going to go and pay the time and attention to do that for you.
Okay.
But you need the screening in the labs and the right doc.
You got it.
Yeah. This
and
isn't
know your
no
risk.
bro science here.
Yep.
Yeah, no. And it's really easy to get these tests. It's just blood work. And
it seems that now it's like there's so many options to get it that you could be such a newcomer white belt type mindset to just walk in and be like, what do I do?
Right.
And there's always somebody like, got you. Come on. Give you the panel.
And there's a lot of clinics that make a fortune on doing this. I mean, you have all these clinics up here. There's now Game Day Men's Health, which is out there. And I really don't know them well. I really don't, or Boston Medical. And, a lot of them are really designed to, in the urology, we call them shot boxes where you go in, you get your shots, and then you go about your business. And I won't, malign them because they may do a very good job at what they do. So, I can't comment personally. And if they do monitor patients, Godspeed to them. And I think it's great. The key is just knowing your numbers and addressing them appropriately. And if you don't get the right answer the first time, second opinions are really important. I really believe that. And whether it's in testosterone replacement or whether it's cancer care or screenings, getting those second opinions is really valid and important.
Yeah, this has been a really enlightening conversation that all comes back to you got to have the data, what's going on inside of you, which is screenings and having an interest and the time commitment and to invest in your own health by just saying what's going on.
And, your health is not a natural. I mean, I'm going to give you one statistic that'll probably blow your mind, is that 53% of men will not make it to age 75.
Wow.
I work in West Bloomfield, so I find that hard to believe. Everybody meets over 138 years old.
Isn't that amazing? But it's absolutely true.
I'm skewed. I'm skewing the data.
But it is actually a frightening statistic, and that was from a recent study on the face of men's health that came out from November. And I think that data should be frightening. And then you've got a Dr. Peter Attia, who's really hot in the news right now, who's talking about how you can be the best that you can be from 75 on. it's important to start looking at how you can age well, because we all get older, but you don't want to get old. And I say that every day. So you can be as preventative as you can, but there's certain things that are just going to happen no matter what. And so you have to really be ready and be able to manage your aging process.
I love that.
That's
Those
great.
Are good closing words.
Yes.
Doc, thanks for coming in. How can people reach you if a first responder agency out there wants to hook up with this mobile unit you're putting together?
Oh, we would love that. Just reach out to info@michiganmenshealthfoundation.org, and we will absolutely address it.
Is that the website they can also go to get information, just to see what's going on and take advantage of your services?
Yeah, we would love that.
What about anybody who wants to donate to the foundation?
Oh, yeah.
Same place, MichiganMen'sHealthFoundation.org. We take donations. That'll help us help screen the men's health community.
That's fantastic, sir.
Awesome.
Thank you so much for your time.
Thank you.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.